Hello, this is Eric Topol with Medscape on the Medicine and Machine podcast, and I'm really thrilled today to welcome Kai-Fu Lee, who is one of the leading AI experts in the world, to join me. So hello, Kai-Fu.
Hi, Eric. Thanks for having me.
It's a joy, and it's a very opportune time with the publication of your new book, AI 2041, 20 years ahead. And before we get to that, let me just give some of our Medscape audience, which are clinicians, a little background. You were born in Taiwan. You came to the US in 1973, had your education back at Columbia and Carnegie Mellon, certainly one of the leading AI centers in the country. And then you has had an amazing career at Apple and Microsoft and Google, leading Google in China. And, you have in many ways been a major force around the world for AI. So we're really interested in your perspective. We first converged when I read your book, AI Superpowers. Was just really blown away by this book because it gave a perspective that is still no other place you can get this, not just about the China and efforts in the US, but worldwide. We had the chance to work on a piece together in Nature Biotechnology called It Takes a Planet, and the idea of collaboration in AI to advance AI in human health and medicine. And then more recently, you culminated in the new book with your colleague, is it Chen Qiufan?
Chen Qiufan.
Qiufan, who is a sci-fi, and this is a very interesting combination of a book that brings together sci-fi and your perspective in AI and in medicine. And you have some personal experience having gone through a whole lymphoma adventure that you, I know, colored your perspective. So let's start off with maybe AI superpowers, since that was kind of a remarkable book, and just maybe give us a skinny on your thoughts when you look back, because that was 2018, and it's a good 4 years ago.
Sure. Back when I wrote AI Superpowers, there were a couple of key concepts that I wanted to get across. First is that artificial intelligence, especially deep learning, is a tremendous breakthrough. And it's a breakthrough a little bit different from what most people think. It isn't about humans programming machines on a if-then-else kind of way, but rather machines that can learn based on a huge amount of data and draw its own conclusions on directions that humans give it. So the amazing thing about this technology is that it will scale with more compute power and more data. Of course, the challenge is that it doesn't really have any self-awareness, understanding, or emotions or creativity as we understand it. So that was the first point. And given that, it became very clear whichever company or country had a huge amount of data has a definite advantage in this process. And a hypothesis was made that China has a huge number of people who use the mobile computing platform like no other country. People spend many more hours on these super apps. So it became clear that these super apps with so many users who use it so many hours will become very good at AI, making money for them, therefore stimulating more people to go into engineering, raising the price of AI engineers, and China would be and inevitably become an AI superpower. And at the time, that was a bit of a possible but a questionable hypothesis. In the last few years, I think we've come to see that's come to fruition, that data is in fact the most important element. Of course, you still need smart people and fast machines. And that was what was primarily the content of AI Superpowers.
Right, and that actually was a subject of a 60-minute segment that you did. Where you actually got into this, what you just described. And I think before we get into the new book, I just can't recommend that enough, because it gave me a vantage point, which then when I approached you to work together for It Takes a Planet. So in that piece, we spoke about, or we wrote about, the idea that if we really put aside political issues and non-medical, the fastest way we could develop a digital infrastructure whereby we could get digital twins nearest neighbor analysis, so that if somebody had a new diagnosis of cancer, they would have the whole world of data to draw on for the best treatment and outcomes by getting their digital twins. And that digital twin could live in China, it could live in Africa, it could, and of course, there could be many, but you would learn in a whole different way than the way we learn today, which is basically from clinical trials and trial and error and all sorts of very rudimentary ways that don't involve AI. But as you pointed out in that, when we wrote it together, the chance of that doing now, of doing that now, is enhanced because of things like federated learning and homomorphic encryption. So could you explain what those are for the uninitiated?
Sure. I personally believe healthcare is the most important application of AI that we'll see in the next 20 years. For the reason that so much data is being collected on each individual, and that includes things that we didn't used to have before, multiomics and very high accuracy MRI and very detailed blood and marker analysis, and also wearable computing data. And that really can create an advent of a data-driven process of understanding our human body, our statistics, and how they relate to our health, and how to tweak various parameters, whether it's sleep or exercise or medicine or nutrients that can make us healthier. And also, of course, the effect of medicine when we get sick. So getting that data was of great importance. And yet, I think nobody wants to just make their health data public. And some people from some cultures and countries care about that greatly. And the way to potentially do that is through a number of mechanisms. The most rudimentary is just anonymize the data, hide the name, age, race, zip code, etc., to aggregate the data. But some of that information is actually useful in understanding the patient's history. So a number of technologies are being investigated now, generally regarded as privacy computing, that allows us hopefully one day to have our cake and eat it too. That means put our data in a place that we trust, and it will not leave that place, but AI aggregation and training can take place with a number of such trusted entities. So for example, if there were 1,000 hospitals, each with 1,000 patients, the patient's data is already in the hospital, so therefore it's by definition accessible to the hospital. Then each hospital would train AI models based on its patients, but no other. And then the models get combined across the 1,000 hospitals. Then we have the effect of training on 1 million people without the trainer ever seeing any data from any hospital. So that's the promise that would hold if the whole planet would work together in that kind of an arrangement.
Yeah, and then the federated learning that you just reviewed is, of course, one of these privacy computing ways that we didn't have, some years ago. And then the encryption has also gone to new levels, like the example of the homomorphic encryption. Can you just speak to that a bit too?
Right. Homomorphic encryption is a technology that allows us to encrypt the data in a one-way technology. So it can be encrypted, but cannot be decrypted. And yet AI training can still take place on the encrypted data and creating models without ever seeing the original data. I should say these two technologies are at different stages of maturity. I think federated learning is ready to be deployed on some scenarios. We have yet to see how much attenuation that we would get by not directly training on the 1 million patients by aggregating the models. But we think it should be a small amount. Homomorphic encryption still has some fundamental algorithmic issues that don't yet work on nonlinear functions like deep learning, but people are working on enhancing that approach.
Yeah, no, that's great. I think, that this is a very hot area for there to be further developments. Now, when you get into chapter 4 of the book, the new book, it's called Contactless Love.
Yeah.
And it's actually about the pandemic. and about what
Yes.
we have learned from the pandemic and about automation acceleration. And, there's a sci-fi part of it, and then you give this extraordinary perspective. So if you can recall some of the key points you were making in this chapter, which I recommend everyone should read. It's really extraordinary.
Thank you. Well, it's a bit of an outside non-medical expert's opinion from the AI side, so I hope I got most things right. There are a couple of things being discussed. I think one is the fact that healthcare has become digitized and how that creates a beginning of a future of precision medicine. That is, the power of AI is not only in its ability to optimize functions like the overall health of all the populations, the likely cure rate, or even the healthy survival rate of patients, but also it can individualize treatment for people. Just like when we go to Amazon, the page I see and the page you see are different. Same with TikTok and Facebook. It knows who I am, what I like, and shows me videos that I might click on, but you might not like those videos. For the same reason, in the future, possibly different diagnosis and treatment can be determined for initially different clusters of people, maybe young people, old people, men and women, etc. But eventually, maybe even a different treatment potentially for every person based on that person's allergies, family histories, and so on. We already know that doctors do that to some extent by rules, but this can really target each individual using data that human doctors don't yet fully have time for or don't know how to understand, like genetic sequencing. So I think that's incredibly exciting. A second aspect I talk about is the use of robotics. And we are already seeing this in China because China has so many people in the pandemic. The need to do very predictable, fast turnaround testing is extremely important. So the nucleic acid testing in China can now be done for cities within 2 to 3 days of 5 to 10 million tests over the 2 to 3 day period. And that is done by these machines that can do 100 times faster than people. And this robotic technology is at work. One of the companies we invested in does this. And there are other companies that do that. And it turns out we discovered luckily that it turns out that the work of medical technicians are relatively easy to replicate compared to, say, assembly of an iPhone. Because assembly of an iPhone requires a very strong vision and hand-eye coordination and dexterity, but much of the technician work is pouring liquids and tests around, and actually robots can make a very tiny droplet of liquid much more accurately and minutely than humans. We actually can see this projecting further that it can take over a lot of the work of medical technicians, which is not just about human replacement and saving money, but increasing turnaround. Machines can work 24/7. They don't make mistakes. They don't get, there's no issue about contagious contamination. And this is like a perfect use for drug discovery and also laboratory experiments used in academia. So one of the companies we fund is now building this platform that can be sold to all kinds of academic and pharmaceutical companies for accelerated pace of experiments and discovery and scientific use. And this is really thanks to the initial product designed for COVID. Now it's really being expanded to many domains in medical sciences. And of course, we all know about intuitive surgical and various types of robotics that is happening now for teeth implants, for spinal surgery, and the list goes on, colonoscopy. And I think we'll see a lot more robotics at work, including very small robots that can do things that even surgeons cannot do. And there will be, of course, a process in which this will become included. It won't be robo-surgeons and robo-doctor from day one. There'll be very small assistants that does suturing and things that doctors don't want to do, and AI can do better, but gradually they'll have more prominence. And the last thing I want to talk about is, which I think is very important, is about drug discovery. We've all read about DeepMind's breakthrough with AlphaFold 2, which is beginning the process of a nearly complete process of protein folding of all the proteins, which can be tremendous starting point for drug discovery. But other parts of drug discovery are being automated with AI assistance also. We've invested in a company that has the ability to, given the pathogen, to propose likely targets based on previous clinical studies, papers, and other knowledge base. And also based on a particular target to propose small molecule solutions to that illness. And it's not working alone, but working alongside a scientist, each proposing and checking, approving, experimentation, and through an iterative process. That part of drug discovery has been accelerated by a factor of 3, with costs coming down by a factor of 10. So the promise is that if and when this can work on many drugs and many phases of drug discovery, the big reduction in the R&D cost can make it possible for scientists to pursue rare diseases, which are financially non-economical to go after, because the $1 or $2 billion of R&D cannot be recuperated because the disease is not common enough. But now with the AI enhanced, more cures can be developed and rare diseases can potentially be cured. So I'm particularly excited about this area because it doesn't bring into any conflict of the medical profession and the AI data profession. It doesn't change the medical process. It doesn't threaten anybody's job. It is a 1 + 1 = 3 kind of an opportunity. So we're hopeful that that many more drugs will be developed with human scientists and AI working symbiotically.
Medicine and the Machine will be right back.
Welcome to Medscape's latest podcast series, Medicine and the Machine, featuring Medscape's editor-in-chief, Dr. Eric Topol, and master storyteller and clinician, Dr. Abraham Verghese. Remember, you can find the latest in medical news, expert perspectives, clinical tools, continuing medical education, and more at medscape.com.
That's great. I mean, I really track with you this idea of the next 2 decades where AI can take us. A couple of quotes in the book, in the story of AI and humans, you wrote, if we get the dance between AI and human society right, it would unquestionably be the single greatest achievement in human history. But as you also pointed out, we are the masters of our fate, and no technological revolution will ever change that. So one of the worries, of course, as you're in touch with as much as anyone, is that there are these dark sides of AI. We touched on the privacy and security, but there are also the issues about worsening inequities, the so many things that are, the lack of explainability and transparency, and on and on. How do you weigh in these counter forces? Because it could be, like you say, the singular greatest achievement, but it also could make our situation in healthcare worse.
Yeah, I think it requires a few enhancements and changes in mentality. I do believe, first of all, that regulations are needed, but I think they need to be more targeted. So rather than just looking at large companies and thinking about breaking them up, I think more specific measures are needed. For example, are there ESG requirements for AI companies, that they are not sharing too much fake news and deep fake, or that they are being transparent. And there's a scoreboard that if they don't do well, they will be shamed, or people won't use their products, or maybe people won't buy their stocks. And there can also be very serious punitive measures, like the Facebook Cambridge Analytica situation. I don't think the US UK laws appear to be strict enough, because I think the Cambridge Analytica people have gone off and done more startups without paying the price.
Right.
And there can be AI audits.
Point. Yes. And the audits? Potentially,
companies that are not trusted or complain too much were complained about too much can be targets of an AI audit, just like an IRS tax audit. Governments can't afford to check every detail of every company, but maybe 1 out of 1,000 potentially serious offender could be audited. Now, how that's done needs to be worked out, but all of these will provide a more fine-grained and stronger deterrence for companies to do better. The second approach I think is very important is for technologists to really work on solutions. Historically, all technology platforms have created problems. Electricity has caused people to be electrocuted. Internet and PC have brought about all these viruses, but eventually circuit breakers solved the electrocution problem largely at home and work. And also antivirus software largely solved the virus problem. So these other problems that you brought up, I think there are technological solutions. We've talked about the use of privacy computing to protect personal data. There are ways to help improve explainability. There are ways to use tools to reduce bias and fairness issues. And I wish more technologists and researchers and startup companies would target these issues rather than just try to come up with the next breakthrough AI algorithm or the next way to make money with the AI algorithm. Think about these externalities and how they can be fixed. So I'm hopeful that the technologists will play a big part in finding the solutions. And the last point I would.
Oh, I'm sorry. Let me get your last point, and then I'll come back to it.
Yeah, the last point is that a lot of these issues happen when the interests of the app or the internet company is out of alignment with the users. For example, if a social network company wants more minutes from the user, that company will train the AI to keep showing enticing videos, which may not be good for the user, but will keep that person interested. And then we end up in a very bad situation where this interest misalignment is causing bad things, causing the watcher to become maybe more extremist in views, or maybe watching videos that are not good for them, but are entertaining in some way. And so I think a better way would be developing business models that are more consistent with the alignment of interests. An example is Netflix. While I'm a big, I use Facebook and Netflix, there's no criticism on either company, but the business model causes their behavior. Netflix is naturally long-term oriented and incentivized because the user pays and the user subscribes on an annual basis. So Netflix must keep the user feel entertained and the content's worthwhile year after year. And the alignment of interest is much closer. Whereas a Facebook, the business model is advertising and eyeballs oriented. So they're incentivized to keep showing us content to get us to click and watch. So we should, as investors and entrepreneurs, think more about business models that are more aligned between the large company and its users.
Well, that's very helpful. One thing I just reflect upon while you're going through the second point was, for real AI scientists, the answer for all the AI problems is always using AI, but
right.
I wish we would incentivize to not the hero stories, but to, as you say, to work on the technological solutions to the problems of, like you say, bias, fairness, explainability, all these things that can be approached technologically. Now, there are two other things I want to get into. One is the status of healthcare AI in China now. You're a first mover in many respects. What do you see in terms, it's still early, obviously, in AI and medicine, but what do you see are some of the things that are happening now that gives you that perspective that you could look 20 years from now?
Yeah, I think China enjoys some advantages from data. Obviously, there are strong data regulations that have come out in China, as well as US and EU. So the regulatory side is comparable. But I think potentially the Chinese hospitals are larger. They have many times more beds than the American hospitals. And also an interesting thing is that there is usually an authoritative hospital in each area. let's say, brain sciences or some other type of illness, then all the hospitals in the country, when they have really tough cases, they submit to that hospital. So there's usually one hospital that possesses a lot of data because it's the authority, and also a lot of problematic data from many hospitals. So the data aggregation is more natural, it's larger, without having to resort to federated learning and the like. So that's one potential advantage. The second is that China's medical practice is behind the US, but that creates some opportunities too, because some companies might be a startup-oriented company that's forward data thinking. And as they gather the data, they're thinking about using AI directly. For example, we're investors in a pharmacy benefit management company that is now accumulating amazing data from users, from their illnesses, insurance claims, and outcome data that I would suspect companies in the US in that category, say a CVS, would probably not be as sensitive to seeing the value of that data. So I think the aggregation of data, the increasing number of young people who study bioinformatics, which is at the cross section of the two disciplines, I think are playing a significant role. We're investors in a couple of companies that come from bioinformatics and are adding AI. And one of the issues of AI plus medicine is the cultural differences between the two disciplines. AI people tend to think of everything as statistics. If the numbers are better, then do it. Then, of course, people trained on medicine, they made the Hippocrates Oath that every human life is sacred. So it's more conservative, more case by case, less statistical. So the medical practices that are in place are not necessarily helpful or friendly to the way the AI data people think. So in China, this emergence of people who've studied bioinformatics can cross both sides, and I think play an important role. And the startups that are either from the AI side trying to get into medicine or from the medical side trying to get into AI, I see more crossovers. And the people tend to be younger because the older generation in China they kind of were educated and trained under, before the technologies were popular. So the younger generation, I think, provides a lot more of the momentum. So these are some of the opportunities I see in China. But clearly in the medical domain, China is still significantly behind the US, unlike AI. So I think there's a lot more to be learned and need to be improved as well.
No, and I have seen, for example, the radiology algorithms put in place to get the screening reads for physicians there, and many things that I would wonder too, that whether remote monitoring of preempting the need for hospitalization will come first in China than anywhere else in the world, because of being able to deal with the massive data you have to develop and validate algorithms, but also the technical ability, going back to AI superpowers, that's really strong to deal with multimodal AI, which is yet a new frontier, a new challenge. Now, the last thing I want to just ask you about, which is where you and I converge, is you obviously have the expertise in AI, but we also both understand how technology can enhance humanity. That is compassion. And you, through your own medical experience, no less through all your different parts of your career, can you just tell us your kind of synthesis of how technology can make medicine more humane and more compassionate?
Sure. One of the stories I often tell is one of the entrepreneurs I talked to. He developed an elderly care robot and deployed it. And to his surprise, he found that the elderly who use the product use by far the customer service feature more than any other feature. So I asked him why that. He asked me why that was, and then we looked into it. It turns out that it was not because the product was faulty and the people were looking for assistance or it's hard to use, but rather the elderly would click on the customer service and then they would say, how can I help you with the product? And they would say, well, let me show you a photo of my granddaughter. And why did my son call today? So I think people clearly want and need the human side in the healthcare equation. That's just as important as an accurate diagnosis and treatment. And also for my personal case, as I went through combating lymphoma, the times when I felt there were people taking care of me, when I felt I had more medical knowledge, and when I felt I would more likely become cured, my confidence went up as a result. So I think it's kind of a placebo effect that my mental state and my confidence and optimism had a big part to do with my recovery. So the doctors can play a much bigger role in that. And there's no doubt that AI will increasingly help the doctor in making the diagnosis, initially in certain vertical sectors like radiology, like breast cancer, et cetera. And the doctor possesses much greater medical knowledge. Over time, AI will get better. There are optimists and pessimists. I'm an optimist, and I believe AI will get better than human in the entire process of diagnosis. I may be right or wrong, but whether I'm right or wrong, the AI can be a very good assistant that can help with the human doctor making the final call, deliver a better outcome and solution and diagnosis and treatment. And that allows the doctor to not have to, spend all the time reading every medical journal for new treatments, to study the statistics, see which of the two treatments are more efficacious. They can rely more and more on the AI. Then the doctor can spend more time with the patients, understanding the family history, teasing out conditions and data that's useful for the diagnosis, and also visit the patient at home and provide more background and give more confidence, and which also increases the likelihood of recuperation. So that combination of the human doctor playing more the human side and spending more time to give the patient more confidence, with AI improving its capability, becoming a better and better assistant, seems to paint a very good symbiotic future for human and AI.
Well, you just summarized the name of this podcast, Medicine and the Machine. No one could do that better, Kai-Fu. I have to say, I'm so indebted to you for your work, and not just these two books, the opportunity to write together. And I'm sure your contributions will continue. They're immense. Your background has put you in an enviable position because you have experienced it from many cultures and many different leading companies, tech titans. So we'll be very interested to follow you. I suspect there'll be a third book coming out in the future. And thank you so much for spending time with us today and enlightening us about your perspective, not just in healthcare, of course, but in the broad aspects of AI. So thanks very much.
Well, thanks for having me.